just a few weeks away now from ECMO and EuroELSO 2014. What can we expect from the program?
So this year's the program has three components. First, there's going to be the cannulation course, which is organized the day before the Congress. On that day, it's going to be a specific course on how to cannulate for VA and VV ECMO on animals. This is a live cannulation course. Unfortunately, we're going to limit the number of people we can attend because this is hands-on with people participating with the monitor on the animal on the cannulation, specifically on the cannulation. So this is the first part of the Congress. Second part of the Congress is the pre-course, which is a very practical course on the way we should manage the patient, both on VV, on VA, both the babies and the adult patients, and it's going to last Wednesday afternoon and Thursday morning. And the main Congress, the main course, is going to take place between Thursday noon and Saturday noon. So this is three parts of the Congress. The highlights, we're going to focus first on patients who have cardiogenic shock and cardiac failure, both once again pediatric patients and adults patients. Those patients will need cardiac assistance, but also people will need other types of assistance like the Impella device, the tandem heart, and other types of techniques which might be available in the coming months and years. So this is cardiac patients. And then we'll have also sessions dedicated to those patients who have respiratory failure, mainly those who need venous ECMO for oxygenation purposes, but also a new technique which is emerging now, which is CO2 removal. There is a high interest in the ICU community and also in the surgical community about these new devices which permit CO2 removal, which might permit in the future to have less aggressive mechanical ventilation. There's a lot of studies which have been published in the past few months about that technique, and also we have an ongoing big trial, international randomized trial, which is going to be called Supernova, with a lot of centers worldwide taking part to that study, and we'll discuss all the issues about this new device and new techniques of CO2 removal. We'll also discuss the opportunity of having research together with centers interested in ECMO. We are launching a new research community which is called the ECMONet. The program has been launched a few months ago, is slightly growing and developing, and we hope to have the first results of research conducted together in the coming months. So this is also a group dedicated to the research, both in VA, VV ECMO, and also in CO2 removal. So there's a growing interest. We also will need more centers in the future. So one of the focus of that Congress also might be to increase the knowledge about the people about this new group, and maybe the opportunity for other groups to join this initiative.
So this is the first year that the course has been held in conjunction with the international course on ECMO. This year we have international course on ECMO and EuroELSO. What's different about this event now that they are joining forces and coming together? Yeah,
it's a big opportunity for us to have the EuroELSO meeting join with our regular ECMO meeting in Paris. It's a big opportunity for us to have a lot of people attending here in Paris the meeting and joining with the ECMO community worldwide. We have people coming from North America, from South America, from South Asia, Australia. So it's a big opportunity for us to mix people and to have a lot of experiences exchanged between people doing extracorporeal support both for cardiac patients and for respiratory patients worldwide. It's a good opportunity for us to exchange the view we have, the results we have, the patients we treated, and the indications, and it's also an opportunity, I told you about, future research project to mix our experiences and to build maybe a new research program for the future.
Mm. And I understand also that this year there is a new component, which is the Young Fellows Grant. Can you tell us a little bit more about that?
Yeah, a few months ago, when we decided to have these EuroELSO in Paris, we discussed with the Congress Committee and other members of the societies, and we thought it was a good opportunity to have young fellows attending this Congress, and we decided to have a specific program helping those young fellows coming to the Congress with a specific grant from some industrial partners to help them come to Paris this May to attend this great meeting on ECMO.
So for any people who have not yet made up their mind about whether or not they can join us in Paris at the end of May, what do you suggest?
First, they have to come to Paris because being in Paris at the end of May is probably a very nice experience. It may be romantic, and it's also going to be a very good opportunity to discuss the present and the future of ECMO and all those techniques which are growing at a rapid pace now worldwide. So just come to Paris and visit us and discuss with us all these issues. It's going to be very interesting, I'm sure.
Thanks very much.
Thank you.